This is Dr. Cheema. Today we will talk about kidney diet, a renal diet. This is a comprehensive review on the kidney diet. I have made several other videos, but they are in Urdu language. So many viewers from India, UK and US who had difficulty understanding or following those charts, they requested that I should make one kidney diet chart in English. Uh, my name is Professor Shafiq Cheema. I'm Diplomate American Board of Internal Medicine as well as Nephrology. Today we will talk about what should be the ideal diet for chronic kidney disease patients. As you know, in addition to diet and exercise, uh, healthy lifestyle is very important. And kidney diet has a significant role to play when it comes to progression of chronic kidney disease. So whenever we talk about diet, we need to understand the importance of diet. We need to know how kidneys work, why diet is important, and this diet has to be individualized. For example, the diet for someone who has failed their kidneys is different as opposed to someone with stage 1, 2, or 3 chronic kidney disease. And we do need to understand our kidney handle water, potassium, phosphate, protein, carbohydrate, fats, and everything. And when the kidneys are diseased or they are failing, they cannot handle phosphorus and potassium and all these electrolytes that well. So they accumulate in the body. So that brings us to the main point that why are we doing a specific diet if we have a kidney disease? So is it to slow down the progression of kidney disease because the dietary recommendations would be different? Or is it to treat the complications of the kidney disease? Because when you have a chronic kidney disease, phosphorus and potassium will be retained in the body. There would be more metabolic acidosis. So the diet would be different to slow down the progression of kidney disease or to prevent the kidney disease as opposed to treat the complications of the kidney disease. That's why it has to be individualized because everybody would have a different diet. It's not one shoe fit all kind of situation. So let's talk about what do we need to do in stage 1 and 2 of chronic kidney disease. Before that, let me tell you if this is the GFR and this is the dietary intervention. So if you do not use any dietary intervention, your GFR would fall rather drastically. But if, for example, here you implement the diet to slow down the progression of kidney disease or to make your kidneys better, the dietary intervention will improve your GFR. So your GFR, for example, would have less significant drop with dietary intervention. So when we are focusing on the early chronic kidney disease, we need to treat the underlying cause. We need to utilize the diet to slow down the kidney disease or to prevent the kidney disease. And usually the dietary restrictions are not that much. Stage 1 or 2 of chronic kidney disease is when you have GFR still more than 60. So I think the main limitation is because most of these people could have high blood pressure, the main limitation would be to restrict the salt. So you limit the salt 2 to 4 gram. In case of salt, 4 gram. In case of sodium, 2 gram. And then you also use healthy diet. You limit refined sugar because if your body mass index is higher, if you're diabetic, that will help control of diabetes. You limit saturated fat because they're not good for the heart. You don't necessarily need to limit protein. So a regular protein intake of around 1 gram per kg body weight is okay. You do not need to reduce it significantly. And usually in this stage, there are not that many restrictions on the fruits and vegetable and potassium containing foods and calcium containing foods. And you could essentially take normal water intake. But as kidney disease progress, there would be more complication. There would be more hyperkalemia, high potassium, hyperphosphatemia, high phosphorus. There would be increased risk of heart disease, more acid development. So in addition to slowing the progression, no, you will be dealing with more complications. Like here, you would also reduce the protein intake to 0.6 to 0.8 gram per kg body weight. So if you are 80 kilogram of body weight, then you will reduce it to maybe 50 to 60 gram of protein per day. Salt, definitely you will limit. Usually there is no restriction on the water unless you have hyponatremia or fluid overload. Carbohydrate, fat, fruits and vegetable, not much restriction, but healthy diet. You will limit refined sugar, you will count your calories, you will limit saturated fat, so that you prevent ischemic heart disease. Because many people from this stage, they do not get to stage 5. The reason for that is they die of heart disease. So you need to make sure you are using a diet which is not only targeting the kidney but also helping your heart as well. So if someone has high potassium more than 5, then you will restrict potassium containing foods. If someone has high phosphorus more than 4 or 5, then you will restrict their phosphate containing food. For calcium, usually in this stage, stage 3 and 4 of chronic kidney disease, there is no restriction. So individually, if we discuss for stage 1, 2, 3, and 4 water, usually there is no restriction. But definitely salty food you will avoid. Protein you will limit. Starches and carbohydrate, you will use more complex carbohydrate rather than refined sugars. You will avoid fatty foods and you will have healthy choices. High potassium containing food you would like to avoid if someone has high potassium. This is treating the complications of chronic kidney disease. If someone has normal potassium, you do not need to restrict all these. If someone has high phosphorus, you will restrict the cheese and the dairy products and the black sodas, everything bakery products which is high in phosphorus would be restricted only if there is phosphorus elevation. Without that, they could enjoy all these foods as long as, for example, chocolate could also increase the sugar, as long as it does not interfere with their other comorbid condition. So then you eventually progress to stage 5 when your GFR is less than 15. Here you have more complication, but you still would like to slow down the progression of the kidney disease. Uh, so your GFR is less than 15. You might have to restrict water a little bit, especially if there is fluid overload or low sodium. Salt restriction would be there. Protein you definitely need to limit so that you slow down the progression. Carbohydrate, fat, fruits and vegetables, same as in the previous stages. Potassium and phosphorus would be more elevated, so the limitation would be there, especially if someone has high potassium and high phosphorus. Calcium containing diet, usually there is no restriction, but most of the calcium containing diet are also rich in phosphorus as well. So you do have to restrict dairy products if the phosphate level is high. Um, let's go to next slide. So here are the list of high and low potassium containing diet. So these are all high potassium containing diet. You could take a screenshot, and these are low potassium alternatives. So people who have high potassium, they will restrict bananas and oranges and orange juice and potatoes and tomatoes. All these are foods with high potassium should be restricted in those people who have elevated potassium. Similarly, high phosphorus diet. So as I just mentioned before, all these are high phosphate containing diets. They should be restricted. They should be limited, especially if you have high phosphorus. And that usually happen in the advanced stage. But if someone has normal phosphorus, they could take all of these. But high phosphorus containing people should use other alternatives which are low in phosphorus. So all these diets, you could take a screenshot and try to take these foods rather than these if you have elevated phosphorus. So three P's are important: protein limitation, phosphate limitation, and potassium limitation. But phosphorus and potassium limitation is only if the level is elevated. So then comes the question, what should be the diet in dialysis patients? So once you go on dialysis, you might have to restrict the water intake. Protein intake could be increased. No, potassium and phosphorus you need to restrict. Since you have a limited diet in terms of fruits and vegetables, you might have to take multivitamin. I have made several videos on this as well. So dialysis population, main restriction would be water. but now they could take normal protein because you're not worried about acid load and high protein. In fact, most of the dialysis patients have malnutrition, their albumin is low, so you want to give them, you want to increase their albumin actually. So you want to give them higher protein diet. Higher protein diet also contain higher phosphorus, but then that high phosphorus you bring it down with the medication. So dialysis patients are at a much higher risk of high potassium and high phosphorus. So you must limit all the fruits and vegetables with high potassium and high phosphorus. These patients should also get a multivitamin so that they don't develop deficiency of vitamins. Then comes the transplant patient. If you end up getting a kidney transplant, water, protein, potassium, phosphate restriction are usually not there, but safe handling of the food, eating hygienic food, steroids have effect on your body that you start eating more, you gain weight. So you need to make sure that even though you have a transplant, you still need to restrict your salt. You still need to restrict some fruits like pomegranate and grapefruit. They have interaction with tacrolimus and cyclosporin. But most of the other dietary restrictions are not there unless you have high potassium and high phosphorus. People who have kidney stones, in their diet, you need to drink more water. You need to drink maybe 3 liter in winter and 4 liter in summer. You need to drink enough water to make 2.5 liter of urine. You restrict sodium, you restrict protein. These three interventions are scientifically proven, evidence-based. Less animal protein, less salt, more water. Obviously, if it's oxalate stone, you will take foods less in oxalate like green leafy vegetables, spinach, etc. You take more fruits and vegetable with more citrate content because more citrate prevents stone formation. Like lemons are good, oranges are good. Calcium, you do not take the calcium containing supplement, but you do need to, you could take yogurt and milk and all that, but not calcium containing supplement. So there is no restriction in terms of diet containing calcium, but supplement with calcium are restricted. Then sometimes people ask if they could take vitamin D or not. Yes, they could take vitamin D. So then comes another question like what kind of diets actually protect the kidneys? You know, there is a full video I made, 5 diets to protect the kidney. Basically, these are the diet which limit salt intake, limit protein intake, diet which help you lose weight. Keto diet have some benefits, but it has some other implications too, because if you end up taking more protein, that might not be good for the kidney. So modified keto diet and DASH diet, diet rich in fruits and vegetable and low-fat dairy product will help reduce your blood pressure as well as indirectly will help the kidney disease. So these are the kidney protecting 1, 2, 3, 4, 5. There is a full video on this topic you could see. Then there are certain diets which could damage the kidney. For example, some people are told not to drink enough water. If they have kidney stone, if they drink less water, they will damage their kidney. If your diet contain more salt, that's kidney damaging. Processed food, kidney damaging. High protein diet, kidney damaging. More protein, but animal based protein, even more kidney damaging. Diet more in refined sugar and carbohydrate, kidney damaging. So you would like to avoid these diet. You will take more water, less salt, less protein, less animal protein, more complex sugar and starches. So this is how you prevent damage to the kidney. If you do not have a kidney disease by doing this, you are basically helping yourself to prevent the kidney disease. Then there are certain misconceptions about kidney disease diet, and this is based on my years of experience from US, Pakistan, and from video comments and all that. So the one misconception is water. Many people, many nephrologists, urologists would restrict your water right away, even in the early stages, which is not recommended. It could be counterproductive. You could develop dehydration, pre-renal azotemia, acute kidney injury, and end up failing your kidney faster than what you would suspect. So no water restriction unless you have a specific need to restrict water. For example, low sodium in the blood, something like that. Or you are a dialysis patient and you're not making any urine. Salt, the misconception is people don't use much salt in the food, but they use food with the hidden sources of salt. For example, pizza and pickle, and there are so many other things which have a significant source of salt. Protein intake, Some people end up using no protein at all. That's not good. You could eat beef, mutton, lentils, everything, but it has to be in moderation. It has to be according to your allowance of zero point 0.6 to zero point 0.8 gram per kg body weight. So no protein diet is a misconception. You could use low protein or moderate amount of protein, but you do not need to eliminate protein from the diet. Carbohydrates, some people think they're bad. Wheat is better than white, brown rice is better than white. So there is a whole video series on this. You could watch that. If you have a kidney stone, obviously the whole grain would not be good for you because it would have more calcium and phosphate and other ingredients. So white bread would be better for you. But overall, uh, white brown wheat is better as compared to white. So fats are generally bad, but there are good fat like polyunsaturated fat you could take. Fruits and vegetables, there are several misconceptions, but essentially you could take any as long as your potassium and phosphorus is okay. Uh, People with CKD can take bananas if their potassium is okay. They can drink milk. If their phosphorus is okay, even if their phosphorus is high, they could take some milk along with some phosphate binders. Similarly, patients are restricted calcium. No need to restrict calcium. High calcium is good. Uh, and sometimes if you have oxalate stones, you could take calcium containing dairy product along with that oxalate containing food, and that will bind it and remove it in the gut, and there would be less chances of kidney stone formation. So then there are situations you have CKD and diabetes, you have CKD and hypertension, you have CKD and glomerulonephritis. So you need to take into consideration the other comorbid condition as well when you are individualizing a diet. For example, glomerulonephritis, many people leak a lot of protein in the urine. They have nephrotic syndrome. The main question is, should the protein be limited or not? So there is no need to limit the protein if you have just nephrotic syndrome or glomerulonephritis and your kidney functions are normal. If you have chronic kidney disease, stage 2, 3, 4, 5, then the diet which I discussed earlier for the chronic kidney disease, that would apply. So for example, if you have GFR of 30, yes, you do need to limit the protein intake. That's because you have developed chronic kidney disease because of nephrotic syndrome. But if you have nephrotic syndrome and your GFR is normal, you do not need to restrict protein. Salt, every patient with nephrotic syndrome, proteinuria, edema, glomerulonephritis must restrict because that could lead to edema formation, and more edema, more fluid could lead to other complications as well. So the only thing, if someone has normal kidney function, they need to restrict is salt. If they have chronic kidney disease along with nephrotic syndrome, then they do need to restrict protein and potassium and phosphorus if their potassium and phosphorus is elevated. So that was all. I tried to summarize, a comprehensive review of diet in different stages of chronic kidney disease, in glomerulonephritis, in transplant patient, in dialysis patient, what are kidney damaging diet, what are kidney benefiting diet, the misconceptions about diet. So in my opinion, this is the most comprehensive video available on social media because many people have touched different aspect of it, and so many video would be there about detoxification, and you eat these 5 fruits and 5 diets and all that. That all does not make any sense. There is no food which could detoxify your body of the toxins. It's overall healthy lifestyle, overall dietary restrictions, overall medical management. Because, in my opinion, medical management with drugs and control of blood pressure and diabetes have like more than 90% role in slowing the progression of kidney disease. And kidney diet has only maybe 10 to 20% role. So many people just do so many things in terms of limiting diet when they are not taking essential medications like ACE inhibitor, ARB, SGLT2 receptor antagonist, and so many other medication. So with that, I would end. Please comment on this, especially the audience from other countries who have requested that there has to be a video on diet in English. I hope this would take care of most of the issues. But if you still have further queries, you could post your question in the comment and I'll try my best to answer that. I hope you like this video and I'll try to share it as soon as possible. Thank you very much. This was Dr. Shafiq Cheema and you were watching NephChat with Dr. Shafiq Cheema. Thank you. Khuda Hafiz.